Now, it's been a busy festive season for hospitals in the Western Cape regarding nearly 5,300 trauma cases being recorded over the New Year's long weekend alone. The province's Health Hospital Emergency Services says majority of these cases were stabbings and gunshot wounds. To tell us more about this, I'm now joined by Deputy Director General at the Western Cape Health and Wellness Department, Dr Saadiq Kariem. Doctor, thank you so much for your time and for joining us this afternoon. Now, how does this number of trauma cases compare to previous years' data, and is there any significant increase or decrease?
Yes, so unfortunately, this season we recorded again high numbers of trauma cases, as you reported now at our emergency centers. Those 5,200 trauma cases represents about 26.5% of the total presentations at our emergency centers across the province. During the period 28th of December to the 2nd of January, we had about 20,000 people who presented at our emergency centers during that period, and that's about 26.5% of them were trauma-related cases. And as you said, gunshot wounds, stabbings, blunt assault, unfortunately even child abuse cases were reported, as well as falls, and obviously sports-related injuries were all part of those trauma cases. But it definitely has increased from previous years. If I look at the same period over the 22-23 year, the percentage of trauma there during that period was around 25%. And we're currently sitting at 26.5% of cases being trauma-related. And again, in previous years, it had been around 19-20%. So over the last couple of years, the percentage of trauma has definitely increased. Much of it, as we know, is related to alcohol, of course.
I was about to ask that, Doctor. I mean, you've got a number of stabbing cases and gunshot cases being the primary cases and the causes of these trauma cases. Is this directly linked to some of the social ills that exist in the area?
Oh, absolutely. It's unfortunate, people misuse alcohol, and particularly with that combined, with the public holidays, we always see an increase in the trauma-related cases over this period. In fact, for the December period, from 1st of December to the 1st of January this year, December 23 to 1 January 24, we had about 119,000 emergency center presentations, and of that whole month, about 32,000 of them were in fact trauma-related cases. So that's around 27%. So definitely, and a lot of those are unfortunately related to alcohol. And we know this because, during COVID, when there were the alcohol bans in the Western Cape, we showed very clearly, our data showed the temporal relationship between alcohol and the violence recorded. If you remember over the December 2020 period when the alcohol restrictions were in place, we in fact saw a 47% drop in our trauma-related cases at our emergency centers. And the maximum number of trauma-related cases that dropped was, in fact, a decrease of 58%. So significant numbers of cases that we see are unfortunately related to the misuse of alcohol.
And then how did the hospitals manage, Doctor, with the surge of these traumas? Were there sufficient resources and staff available to deal with such traumas?
So we have to plan, because we know that this is a pattern that unfortunately repeats itself, and I'm sure the Western Cape province is no different to other provinces in South Africa. So we have to prepare ourselves months in advance to make sure that the hospitals have sufficient consumables to be able to deal with the surge in trauma during the festive season. But also we have to make sure that we obviously have sufficient staff. So we look very carefully at the leave applications of our staff members to try and make sure that we will have sufficient consumables and sufficient staff at our trauma centers, emergency centers. But more importantly, or as importantly perhaps, we also have to ensure that our emergency services are well prepared. So our EMS colleagues, for example, over the same period, 28th December to 2nd of January, saw a total of 9,000 calls that had come into our emergency center, our EMS services. And we work very well with all the other EMS disaster preparedness centers as well. So we make sure that there's enough consumables, that there's sufficient staff, and that we roster people appropriately to cope with the surge in trauma during this festive season.
And did they experience any challenges with the timely ensuring of treatment and being effective, especially with such a large number of trauma cases at the time?
No, definitely. Unfortunately, because we have the triage system, in other words, patients who are triage code red, for example, are very urgent and have to be seen immediately. Most of the stabbings, gunshot wounds, assault cases would be classified as red. So in other words, they have to be seen immediately. And unfortunately, this means that there's now then becomes a backlog on patients who are then less serious with less serious injuries who present to our emergency centers. And that's a challenge that we face all the time at our ECs, not only in the festive season, but we also see that same pattern emerges during weekends as well as public holidays. And that triage system then allows us to try and cope with the increase in trauma. And of course, we have to make sure that theaters are available, that ICUs are available, and unfortunately, all of that also takes up resources.
Of course, it certainly does, and I'm sure I can imagine that there needs to be collaborations with other hospitals, other emergency service providers in order for you to be able to handle these increased numbers.
Absolutely. We work very well and very closely with provincial authorities. I'm talking about all of the provincial emergency authorities, whether they be police, traffic, fire, and the local municipalities play a crucial role in our disaster preparedness and our festive season preparedness. Cape Town obviously is the largest municipality in the Western Cape province, and so we work very closely with our colleagues in the municipality of Cape Town, but also with our colleagues in other government departments. So prior to the beginning of the festive season, we have a coordinated response with our colleagues from social development services, obviously looking at children and protecting families. We work with our colleagues in cultural affairs and sport, with our colleagues in education, with a whole range of government departments. So really it is a collective, combined response from the Western Cape.
And are you able to provide support and assistance to those that have been injured beyond the immediate treatment that they get at the hospitals?
So we do, yes. Some of that immediate support post the trauma obviously would be rehabilitation, and so there's medical support that's required. But because we are able to work with our colleagues in social development and the other sectors, as well as our NPO partners, who play quite a crucial role in all of our response, we do try to provide trauma counseling, debriefing, and support beyond the immediate physical trauma and beyond the immediate medical care that is required. But obviously, given the large numbers of people that come through our emergency centers, that does at times become a bit challenging to also provide that to everybody.
Of course, of course. And then are there any plans to increase public awareness about the impact of trauma incidents and also just to promote safer behavior? As you said, there was a good correlation between the alcohol abuse and the violence that's experienced, especially at that time of the year.
Absolutely. Early in the year, the Premier of the province, Premier Windy, and cabinet ministers launched the area-based team approach, which is our attempt in the province to reduce violence in the province, and a couple of areas that are hotspots. Delft is one of them, for example, Kraaifontein and other areas, and Guguletu, Khayelitsha, all in the rural areas, for example. So as part of that area-based team approach, there are awareness campaigns in those specific areas, but we do also try to put general awareness campaigns out to the media. Unfortunately, not everybody listens to our media campaigns and messages, and so it does become a bit difficult. But through our area-based team approach and our violence prevention efforts in the province, we are certainly trying to put out messages around the link between alcohol and violence and trauma.
And is there a need for additional funding or resources to better handle such a high influx of trauma cases?
Oh, I guess there's always a need for additional funding and resources, but what we tend to do within the resource envelope that we do have, we obviously manage that effectively. So towards the December and January period, we de-escalate outpatient services, for example, and we de-escalate patients who don't require immediate surgery and a whole range of other medical services. So we try to do that de-escalation in order to provide us with the financial space and envelope to be able to cope with the surge in trauma. So that's how we manage the financial resource envelope.
Lastly, Doc, we spoke earlier on between the correlation between alcohol and violence and some of the social ills that exist within the province. Do you have any ongoing research or data analysis efforts to understand those underlying causes and trends that lead to such high numbers of trauma cases in the Western Cape?
Yes, there's definitely ongoing research. Some of our research partners that we are working with and collaborating with are looking into some of the aspects of alcohol-related and particular incidents, particularly trauma. But also, I think it's also just part of general societal ills, I suppose, particularly during the festive period. And as part of that area-based team approach that I mentioned earlier, we are working collaboratively with our partners across the different government departments, looking into what the causes of trauma and violence are, particularly our partners in community safety, police oversight in community safety, are doing some research in some of the local areas to better understand the impact that that has on our society. Our colleagues in social development, for example, are also looking at gender-based violence. So there are particular areas of interest as well, where we are doing ongoing research and collaborating with various government departments.
All right, Doctor, thank you so much for your time and for joining us. And we certainly do hope to see a decrease in those numbers come the next festive season.